So with scoliosis, we just have to make sure that we follow the spine. So because your spine is kind of shifting all the way through here, you don't ever feel any pain, right, Rachel? No. Okay, good. Even here, we can see the torsion of her spine that's coming out over here. She has a forecurve scoliosis, right? So with the forecurve scoliosis, there's less of a rib hump. There's more of a lumbar, basically a lumbar hump, right? So again, like this is like far left of here. We want to bring that more into center line. Even starting like today, trying to get that more back in the center line too. Do you see like how much her torso leans to this side?
Yeah,
like the whole torso, her whole rib cage? Actually, that's one sign that we can actually make some changes into there, when we can actually get our rib cage a little bit more into there, right? We can't fully change her scoliosis, like, you know, there's that hemivertebra that's down there, that trapezoid shaped like vertebra. So we can't ever fully like get that, you know, I can't regrow that joint, right, or that bone, but we can definitely make changes in the global posture. So there's something over here at the very top. When patients have scoliosis, is we dot where things are. So, actually, right there. Okay. Like feeling down her spine, I actually have to kind of like be way out here. It might not, you know, her spine is not here where it should be. It's out here. So her muscle bulk is right here, but right there is where it's painful, right? Yeah. Okay, so this one does not move very well over to this side. I'll kind of do that. Is that tender? Yeah, okay. Right there, right? We're going to be adjusting her upper bone. Okay, so we'll be adjusting that to actually help with her center of gravity too. I mean, that helps with the center of gravity, but another thing we want to do is also adjust over here too. Okay, so what I'm going to be doing, it's the one above that hemivertebra. That one we still can make a change with. The hemivertebra is because she's been leaning so far over like that way so long that the growth plates didn't like, you know, grow symmetrically too, right? And so we want to actually do as much as we can with that joint. Okay, it's shifted backwards, so what we're actually going to be doing is shifting that forwards too. So you just relax your left shoulder a little bit and then give this a little push. Good. Good. Relax your shoulders a little bit. Good. Good. Okay. I got some of it, but let me come up. So just relax a little bit more. Good. I will give exercises that are specific for her. This is what you see, but what's actually happening inside is scoliosis is a rotational phenomenon. Yeah, it's all rotational, so we're actually concerned about like anti-rotation, right? So part of that is the core, part of that is like other things. It's not this side to side. If you look at the individual things, you can see how much rotation is actually happening in there. That's why it's a little more tricky with scoliosis, is making sure we adjust in a very specific manner. Yeah. It's coming more back in the center line, even with that. It might be harder for you to see, but you can let me know.
Yeah, I can see. Yeah, it looks like more center line.
Yeah, it's more center line.
This part, yeah, I can see.
Yeah, this is for sure. Yeah.
And this degree, like, it's getting better, I think. Like, because it was like a very one side is hard.
Yeah, that's a result of this. Yeah. As great as this type of changes, I mean, literally, what brace is going to do that, right? What you just saw right now. But cool. All right, Rachel, how do you feel? Good. Okay. Cool.